Healing through trigger point therapy, a guide to fibromyalgia, myofascial pain, and dysfunction. Chapter 1, General Overview. What this book is. Healing through trigger point therapy, a guide to fibromyalgia, myofascial pain, and dysfunction is written primarily for patients with chronic pain and those with other previously unexplained symptoms associated with fibromyalgia, trigger points, and chronic myofascial pain, and for their care providers for all varieties. It is designed to facilitate communication among them and to be used as a tool for FM, TRP, and CMP diagnostics, care, treatment, and prevention. TRPs are one of the main factors generating and perpetuating FM pain and other symptoms. No matter what initiated the FM amplifies the pain and other symptoms. TRPs can cause acute or chronic pain as well as surprising diversity of seemingly unrelated symptoms that are often mistakenly linked to FM. The TRPs can mimic many conditions, causing diagnostic confusion. TRPs tend to refer pain in specific referral patterns. This book can help match symptoms to the TRPs generating those symptoms and will provide the knowledge you need to bring those symptoms under control. It is also a tool that you can use to help explain those symptoms to others. TRPs can cause such diverse symptoms as impotence, loss of voice, pelvic pain, muscle weakness, cardiac arrhythmia, menstrual pain, irritable bowel syndrome, clumsiness, toothaches, shortness of breath, headaches, even migraines, and incontinence. The good news is that TRPs can be treated and they can be prevented. Control of TRPs results in control of CMP and FM and can help with control of coexisting conditions by minimizing symptom burden. Everyone needs to be familiar with TRPs. They can cause symptoms that mimic conditions seen by general practitioners and every type of specialist. Every medical care professional has seen patients with TRPs, although TRPs are often unrecognized as a symptom cause. TRPs can cause a number of altered sensations, including numbness, itching, dizziness, burning, prickling, heat, or cold. The older population needs to know about TRPs because they are treatable causes of range of motion loss, muscle weakness, pain, and other symptoms often blamed on old age. Osteoarthritis may be minimized if related to TRPs are promptly treated. Prompt control of TRPs can prevent FM from developing and minimize its impact once it has. Those involved with children need to know too, because growing pains are due to TRPs. Athletes need to know this material because TRPs are one of the most common sources of musculoskeletal pain. Physical therapists need to know since strengthening exercises worsen the muscle weakness caused by TRPs. Insurance agencies need to know because prompt diagnosis and treatment may avoid surgery and other major expenses later. Chronic pain patients need to know because most chronic pain conditions have a treatable TRP component, and treating TRPs can substantially relieve the symptom burden. For example, the pain and ROM in an otherwise well treated case of arthritis may be significantly improved by treating the TRP component. This book will enable the medical care team to treat more efficiently and will teach patients what they need to help regain function and gain some control over symptoms. TRPs may seem complicated, and for some part they are, but they also are very treatable. This book will show you where and how to look for the TRPs for each symptom. You will learn what can perpetuate each TRP. Both patients and care providers will learn how to treat and prevent them. This book offers empowerment and hope to patients and direction to care providers. FM and TRP symptoms are real. Although we don't currently have all the answers, a great deal is known, but the practical applications of the latest research are not often in use. This book will help bridge that gap. We believe that there's already too much pain involved in FM and TRPs and have attempted to make this book as understandable and pleasant to use as possible. What this book is not: Healing through Trigger Point Therapy, a guide to fibromyalgia, myofascial pain, and dysfunction, is not a substitute for an education in FM, TRP, and CMP medicine. Patients with these conditions need a great medical team. This book will help patients find such a team and help care providers to become a part of one. In the best possible worlds, every healthcare team and every patient would be one that considers and understands chronic pain management, including TRPs. This world does not exist yet, but this book is part of the effort to transform medical care into a more efficient, user friendly experience.